So my name is Angela Fortune. I'm a nurse practitioner with the Department of Medicine, Division of Hospitalists for the Prisma Health Lawrence County Memorial Hospital. I grew up and around Greenville, South Carolina in the upstate, in varying counties around Greenville, South Carolina. I hold 2 nursing degrees from Clemson University School of Nursing. I hold a Master's of Science in Nursing with specialty of Family Nurse Practitioner. Actually, I am a 25-year plus nurse. I've been at the bedside for the last 25 years. There's an ever-growing need in the rural community for providers. The healthcare providers as a whole are an ever-aging populace, and as the healthcare providers retire, there's not as many coming in to take their place, and that's kind of what the nurse practitioner role was developed to be. South Carolina as a whole is houses one of the largest rural communities in the South. There's an ever-growing need for nurse practitioners in that area. It just is something that I'm passionate about, and that's what drove me to Lawrence, was the rural nature of that community. A nurse practitioner is a mid-level provider that works in conjunction with a primary care provider in this state. We work alongside the primary care providers as a kind of extension of their role to provide more primary care providers at the bedside. We do the exact same thing that a physician does. We just have that guidance from and collaboration from our collaborating physician. I inspire health in my patients just by kind of encouraging them to maintain their visits with their primary care provider, making sure they're eating a heart-healthy diet, exercise, limiting alcohol in their diet, smoking cessation, taking their medication as prescribed until told otherwise, and just making sure that they have some sort of connection with primary care provider, because that's what's wrong with rural health. Rural health doesn't have enough primary care providers, and people are kind of falling through the cracks. That's what nurse practitioners are bringing to the role. So getting patients to connect with those providers, stay in contact with the providers, will help them increase longevity and better health. When I'm not at work, I actually am very family-oriented. I spend a lot of time with my family. I read, crochet. I'm very crafts-oriented, but mostly it's that avenue of getting away from work and being with my family and connecting with family, my church environment, my mother, my just immediate family, which is what brought me back here. I moved away for a while. I came back just because Greenville just is my home. So, family.